Wait. There is a wrong way to help a victim. There is an accident and you are the only bystander. What should you do? Let's run it back. Always remember DRS ABCD. D is for danger. Evaluate environment for danger. R for respond. If the person is conscious, perform secondary assessment. Alert. You can ask for their name. Voice. Ask question they have to verbally answer. Pain. Pinch painful area for response. S for send help by calling 999 to inform the current situation. Then conduct a head-to-toe check to understand their overall status. While waiting for emergency medical responder to arrive, gather information using sample, which are sign, allergies, medication, past personal history, last oral intake, and event proceeding. Seems like we are forgetting something. What if the victim suddenly lost consciousness?
A for airway. Use head, tilt, chin, lift and clear any visible obstructions. Breathing. Observe the rise and fall of chest. Place ears near mouth or nose to hear breathing sound. Place your finger near their nose to feel the air with your finger. Our victim is having abnormal breathing, hence we need to begin CPR immediately. Place the heel of one hand on the center of the chest, lower half of the breastbone, and place the other hand on top and interlock your fingers. Position your shoulders directly over your hands and keep your elbows locked and arms straight, using your body weight to push down. Push down at least 2 inches at a rate of 100 to 120 compressions per minute, and you can sing Uptown Funk, Espresso or Staying Alive and match the beat per minute.
C for circulation. Check for stable pulse. D for defibrillator. Find nearby AED to treat sudden cardiac arrest.
In this video, I'm going to demonstrate how to use a defibrillator. By this stage, you would have started CPR already. Once the defib arrives, you're going to turn it on and you're going to follow the prompts. The defib will give you really easy and clear instructions of what to do.
Remove all clothing from patient's chest. Pull red handle to reveal pads.
Now it's time to place the pads onto the person's bare chest.
Apply pads to bare skin exactly as shown in the pictures. Press pads firmly.
At this point, the defibrillator will start analysing the person's heart rhythm.
Analysing heart rhythm.
The defib will advise us to stand clear and it will advise a shock is being delivered. Step back from the patient and keep your hands in the air. That way we're letting any bystanders know, do not touch.
Delivering shock. Shock delivered.
If a shock was not successful, we need to continue with CPR.
Provide chest compressions to the beat. The heel of one hand should be in centre of chest. The other hand should be on top of first hand. Push down hard at least 5 centimetres. Stop chest compressions.
After 2 minutes of CPR, the defib will actually stop and analyse that person's heart rhythm again. If a shock was not successful, we'll need to continue with our CPR. If the shock is successful, you'll notice that the person is now responsive. Comfort them, leave the pads on, and wait for emergency services to arrive.
Inform EMS the information gathered with sample. Congratulations, you just saved my life.